According to the National Institute on Drug Abuse, 130 people a day are dying from opioid overdoses, and those numbers are rising, even though fewer pain meds overall are being prescribed. Experts believe patients are in pain. Sometimes they take more pain medication than they intend, or they mix the drug with others. So some doctors and pharmacists now demanding that Narcan, a drug that can reverse an opioid overdose, be available to everybody prescribed opioids and be available at home. So joining me now, Dr. David Tauban, Chief of Pain Medicine for UW Medicine. A pleasure to have you. And Ryan Oftebro, who is the CEO of Kelly Ross Pharmacy Group and a pharmacist himself. So thank you both for joining us this morning to talk about it. And I guess we start with, how did we end up here?
Well, we ended up here with the best of intentions and without enough evidence to support a big sea change in the view that pain deserves opioids. Patients with pain deserve opioids, and we'll give them as much as it needs to quench the pain sensations. It didn't work.
Right. So, Ryan, this is a topic that you are passionate about. You have a tragic understanding of overdose death. Tell us about your cousin.
Sure. My cousin, Ryan Sullivan, was a great young man, but he died of an opioid overdose. And that was really the driving force behind the work that we're doing today at Kelly Ross. This happened in 2011. In 2012, we created a protocol that allows pharmacists to actually prescribe and dispense Narcan as a take-home Narcan kit, naloxone kit, to anybody that's at risk of an overdose or anybody that's at risk of witnessing an overdose. So we really want to make sure that there is a life-saving solution that's accessible to the public when they need it.
What typically happens with people who accidentally overdose on opioids?
Basically, they stop breathing. Opioids suppress the drive to breathe if oxygen is low, or the drive to breathe if your carbon dioxide is too high. So it just shuts down the normal sensation of not getting enough air.
Okay, so what is the solution overall to stop this?
Well, there's two solutions. Prevention, and there's two parts of prevention. One is prescribe fewer opioids and also restrict the inflow of illicit opioids into this country. And the other is prevention by providing a drug like naloxone, which blocks the opioid from producing that effect, and it blocks it very quickly and saves lives.
Okay, so if it was available, Narcan, naloxone as it's called, if it was available to everyone using opioids, how many lives could we save?
Go ahead, Ryan.
I think that's going to be difficult to answer, but we do have some good data. King County distributed over 8,000 naloxone kits in 2017 to high-risk populations, and of those, 1 in 4 was used to reverse an overdose. So it is a very effective modality.
And we also know that by being given a prescription of Narcan or naloxone in the physician's office, reduces the patient's likelihood because they recognize there's a higher risk.
Right.
And it may be contributing to the reduction from our public's perception that these are safe drugs.
There's power in education. So if this is something you've been on the forefront of with your group, if this was to be standard practice, what would it cost to get a program like that started and continue it along?
Sure. Well, it is a prescription drug, but we've created a what's called a collaborative drug therapy agreement that basically, if a pharmacist and a physician partner on this agreement, that pharmacist can prescribe the drug. So this can happen in any pharmacy, and it's happening in many, many pharmacies around Washington State already. StopOverdose.org is a great resource, and it has a pharmacy locator to help people find pharmacies that are participating in this. They can also have their physician write a prescription for Narcan. So there's several access points that are available already. It's also covered by most insurance plans, as it is a prescription drug. So a lot of people have access to it already and they don't realize it.
Ryan Oftebro, Dr. Tauban, thank you so much for your time. Appreciate it. Very important conversation.